Today we're going to discuss two of the most common myths that you may have heard about your spine. Number one, we're going to have a chat about degenerative disc disease and how what your x-ray scan tells you may not be the true cause of your symptoms. Let's have a look at what the research tells us. A systematic review by Bring-Jikji suggests that the prevalence of disc degeneration in asymptomatic individuals increased from 37% in 20-year-olds to 96% in 80-year-olds. What this tells us is that there is a majority out there with similar scans to you and absolutely no back pain at all. For all we know, your scan could have showed similar degeneration multiple years ago, so why have the symptoms only started now? There is likely something else going on. The second common myth that we're going to discuss today is when we hear of people being out of alignment or having a slipped disc. This is physiologically inaccurate, as our spine is a strong, flexible structure capable of dealing with load and movement in multiple directions. It is also surrounded by ligaments and soft tissue structures that provide adequate support and stabilization of the spine. Why do people believe this? Most likely you have been told or heard from a friend, someone at the gym, or even from another healthcare professional just before they're about to perform a technique like manipulation, or when you hear a cracking sound and feel that short-term relief. The crack that you hear is actually a release of pressure or volume within the joint, and the short-term relief is due to the changes in the nervous system, allowing the muscles surrounding it to relax. So there it is, the two most common myths we've been told in the clinic about your spine. If you've heard this before, or you're not quite sure what's going on with your injury, feel free to comment or send us a message below, or book in with one of our physios to find out the true cause of your symptoms.